You're looking at an example of what our lungs look like, normal lungs versus asthmatic lungs. Dr. Antony Ham Pong is here, CHEO Asthma and Allergy Consultant. Morning. Welcome to the program.
Good morning.
This is very interesting. The fact that there's a spike in asthma cases in September when children go back to school. Matter of fact, you can be very specific about when it is.
That's right. The studies have shown that the spike occurs after Labor Day, but really school start day, 9 days after school starts, there's this big increase and the emergency rooms gear up for these asthma admissions and hospital visits.
You brought clinical evidence of that right here.
That's right. This is at the Children's Hospital, and in the summertime, the asthma emergency room visits and hospitalizations are low.
Yep.
And the spike happens in September, major spike. And the hospitals gear up for that because they know it's going to happen.
So 9 days is obviously the incubation period.
That's right.
For various viruses.
Yes, cold viruses. The children go back to school. They're in this classroom. Not as good ventilation. They're coughing and sneezing on each other.
Right.
It's a breeding ground for viruses.
Now, these children who end up with asthma attacks, let's just call them attacks in general, are these kids who are asthmatic already, or does these viruses bring out the asthma in them?
Many of them are asthmatic already, and the virus is a big trigger for the asthma. So when they get a virus, if they're not on preventive asthma medication already, they'll get an attack. But some parents are surprised when their 5-year-old, 6-year-old child goes to school, and that September they have their first ever asthma attack.
That's when they discover that their kids are asthmatic?
Yes, that's right.
Really?
And if you are already asthmatic, it's a good idea to prepare beforehand, starting with your daily preventive medication.
Okay, and it depends on the individual, or?
Generally, late August, beginning of September. Beginning of September is the latest you should start your preventive medication to prepare for this spike.
What kind of medication is that?
These are not your reliever medications. Those help your symptoms, but to reduce the inflammation in the lungs, you need your asthma preventer medication.
And this is what happens, right? Because this is a normal lung, right? And you can see that with the swelling starts and there's more mucus. So much more in here.
And narrowing of the airways. So that's why there's difficulty breathing and wet cough.
In the severe cases, that's dangerous.
Yes, I mean, luckily with good control, asthma doesn't have to be fatal. Most people do well with it with good asthma control.
These are puffers and
these are
the
devices
equipment
to use
that goes with it. So this goes over the mouth, the puffers here.
Yes.
And this is an aerosol treatment, right?
That's right. And the key thing is to take your preventive medication daily during the entire season.
Why do you have hand sanitizer on the table, doctor?
Very important to reduce transmission of viruses, infections, and that's one of the key things. Hand washing.
That's preventative?
Preventive to prevent the cold viruses that trigger asthma.
And I know you brought some of these face masks along.
Yes.
I don't see a lot of people around wearing those. Not in this country.
That's true, but the adults, if you do have a cold, and the adults who deal with a lot of children, if they do have a cold and do not stay home, they should wear masks to prevent transmission of these cold viruses.
Really?
You can certainly reduce the colds and then the number of asthma exacerbations.
Boy, that'll work in a workplace or anywhere like that.
That's right. Visiting a doctor's office, workplace, classroom.
Very interesting, though, that you've narrowed that down in your studies of asthma and the like to that 9-day period after school starts.
Now, the increase in asthma flare-ups begins just before school starts, but really that peak, major peak, is
next week. Be next week for most people,
pretty soon.
So people should go check with their doctors and make sure everything's good?
Make sure their medications are refilled, so if they haven't started their preventive medication, they should as soon as possible. And those who do not have asthma, the early signs to watch for in asthma are a cold, which is very different. It really goes to the chest. There's a lot of mucus, coughing, trouble breathing, this wet cough, and this wheezy cough.
Okay.
A whistling sound when you breathe.
Something to watch for, especially those of you with kids going to school for the first time, probably. You may find out some answers to some questions you've been having. Doctor, thank you very much.
Thank you.
Pleasure to talk to you. Very interesting topic.